I'm Nikki Burnham, the Nursing Director of 7 Stoneman. I'm going to review some of the frequently asked questions that our patient asks about their total joint replacement. Please be sure to read through the guidebook provided to you by your surgeon or watch other videos for more details on your upcoming total joint replacement surgery. Your new joint is made of metal alloys, titanium, cobalt, chrome, with either a polyethylene, plastic, metal, or ceramic bearing surface. These parts weigh about a pound, give or take. Yes, it may. There is no danger to you or your new joint from any of this surveillance technology. If you need to pass through a metal detector at an airport or public building, inform the security officer that you have a metal joint implant. You will be screened separately. A letter from your doctor saying that you have an implant is not needed. Joint replacements tend to function very well for many years. At 20 years, 90% of joints are functioning well. Follow the instructions you were given by your physical therapist for recommended activity restrictions to protect your joint. The day before your procedure, you'll be notified by the surgical scheduler of the time you need to report to the hospital on the day of your surgery. If you've had your hip replaced, you should plan to be discharged the first day after surgery. If you've had your knee replaced, you may be discharged 1 to 2 days following surgery. Your surgery will be approximately 2 to 3 hours. Patients should aim to be ready to go by around 2 p.m. on the day of discharge. Prior to your surgery, please make sure you have a ride planned on your discharge date. Incision size varies depending on the type of surgery that you have, your body shape and size, and other factors. You will be given detailed instructions at discharge on how to care for your incision. Please follow these directions to keep your incision clean. You will be given instructions on when you can shower at home. When showering, do not scrub at the incision. Let soap and water run over the incision. Your surgeon will let you know when you may resume these activities. It is usually 4 weeks after surgery. Avoid very hot water, such as a hot tub, as this can cause the operative leg to swell. Not all incisions will have staples that need to be removed. If you do have staples in your incision, you will be given instructions for when these need to be removed. They are usually removed within 2 to 3 weeks after surgery. Your feet and ankles may be swollen for at least a month or more after surgery due to decreased activity and temporary changes in your blood circulation. Talk to your surgeon about any concerns you have regarding swelling. Over time, you will start to decrease your use of prescription pain medicine. Although everyone is different, most patients are off narcotic pain medicine between 2 to 6 weeks after surgery. Please plan ahead for refills. Narcotic pain medicine prescriptions cannot be called into your pharmacy. Prescriptions must be mailed to you or picked up at the doctor's office. If you start to run low, please call your doctor's office at least 3 business days before you run out of medication. Most patients will be on blood thinning medication for 4 weeks after surgery. You should continue to take these medications until you have stopped taking narcotic medications, which can be constipating. You want to avoid straining when you use the bathroom. Check with your surgeon about when you may resume driving. For most patients, this is at least 4 to 6 weeks after surgery. The length of time out of work will vary depending on your profession. On average, people with jobs that involve mostly sitting can return at about 1 month. Those with jobs that have a higher activity level may need longer. Please let the surgical scheduler know as soon as possible if you need a work note or disability paperwork as a result of your upcoming surgery. Because of the number of patients we care for each week, it takes our office up to 10 to 14 business days to complete these types of forms. If we receive them well in advance of your surgery, we will do our best to ensure that they are returned to you in a timely fashion. Because prolonged sitting may place you at risk for developing a blood clot in your leg after surgery, we recommend that you do not travel long distances for 6 weeks. Please discuss travel plans with your surgeon prior to surgery. When you do travel, be sure to stretch your legs and walk frequently while awake. You may resume sexual activity as comfort allows. If you have had your hip replaced, you will need to be very cautious for a full 3 months, paying close attention to the position restrictions that your physical therapist has discussed with you. It is okay to resume drinking alcohol when you have stopped taking narcotics and can walk steadily on your own.